Good morning, all of you. Today we will discuss practical number 6, and the topic of practical number 6 is to determine and analyze posture and its common faulty postures. Now, posture. Posture can be either static or dynamic. Now, in static posture, body and its segments are aligned and maintained in a certain positions. Now, example of static postures include standing, sitting, laying, kneeling. In other words, dynamic posture, it is a posture in which body or its segments are moving, that is walking, running, jumping, throwing, lifting. This is a dynamic posture. Basically postures are divided into two parts, static postures and dynamic postures. Now the study of any particular posture including kinetic and kinematic analysis of all body segments. The erect standing posture allows person to use their upper extremity for the performance of large and small motor tasks. Now, if the upper extremity need to be engaged by the use of crutches, can or other assistive devices to maintain the erect posture, important human attribute is either severely compromised or lost. Now, erect bipedal stance increases the work of the heart, places increased stress on the vertebral column, pelvis and lower extremity and reduces stability. Now, in the quadruple posture, the body weight is distributed through upper and lower extremities. Now, human species, that is base of support, which is defined by an area bounded posteriorly by the tips of the heels and by the anteriorly by a line joining the tips of toes, which is considered smaller than quadruped base of support. Human center of gravity is the point where mass of body is centered and will be referred to here as a center of mass. Now, position of center of mass is not fixed. Changes in different positions such as sitting, kneeling with movements of extremities or trunk when a person is carrying something. Now in a younger child, in standing posture, center of mass is located within the body about at the level of 12th vertebra. As the child becomes less too heavy, center of mass moves lower to a location in the standing adult at about the level of second sacral segments in the mid-sagittal plane. Now the adult position of center of mass is relatively distant from the base of support. Postural control, although only a relative small amount of muscular activity which is required to maintain a erect standing posture. Control posture is complex and is a part of body motor control system. Now postural control. Postural control is either static or dynamic, refers to a person's ability to maintain a stability of the body and body segments in response to forces that threaten to disrupt the body equivalent. Major goals and basic elements of control are to control the body orientation in space, maintain body center of mass over the base of support, and stabilize the head with regard to the vertical so that the eye gaze is approximately oriented. Now, absent or altered input and output. When input are altered or absent, control system must respond to incomplete or distorted data, and thus the person portion may be altered and stability compromised, or absence of input may occur for a number of reasons, that is including among other absence of gravitational force in weightless condition during space flight or decreased station sensation in the lower spaces. Now, according to author, muscle activation is based primarily on input from the hip and trunk proprioceptor. A second level of the input include cues from the vestibular system and proprioceptive input from all body segments. The perturbation is any sudden change in contraction that displaces the body posture away from equilibrium. The perturbation can be sensory or mechanical. A sensory perturbation might be caused by altering visual input, such as might occur when a person's eyes are covered unexpectedly. Now, mechanical perturbation are displacement that involve direct changes in the relationship of center of mass to the base of support. Now, these displacements may be caused by the movement of either body segment or the entire body. Even breathing can displace the center of mass. The perturbation in standing that result from the respiratory movements of the ribcage are counterbalanced by movement of the trunk and lower limb. The group of muscles that respond to the perturbation is activated in an attempt to restore the within the base of support. The burst of muscle activity occur in ankle dorsiflexor, hip flexors, abdominals, possibly the neck flexors. The muscle strategy described in response to perturbation are examples of the active internal forces employed to counteract the external forces that affect the equilibrium and stability of the body in the erect standing posture. The external forces that will be considered are inertia, gravity, ground reaction force. Internal force are produced by muscle activity and passive tension in ligaments, tendons, joint capsules, and other soft tissue structures. The sum of all of the external or internal forces and torques acting on the body and its segment must be equal to 0 for the body to be in equilibrium. Now, stability is maintained by keeping the body center of mass over the base of support and the head in a position that permit gaze to the approximately oriented. Now, what is inertia and gravitational force? In the erect standing posture, little or no oscillation of the body. The body undergoes constant swaying motion that is called as posture sway or sway envelope. The extent of the sway envelope for a normal individual standing with about 4 inches between the feet can be as large as 12 in the sagittal plane and 16 in the front. Now, inertia forces that may result from this swaying motion usually are not considered in the analysis of forces for static posture. Naturally, inertial forces must be considered in posture analysis of all dynamic postures such as walking, running, jogging, in which forces need to produce acceleration or change in direction of motion are important for understanding the demands on the body. Now, ground reaction force. Whenever body contact the ground pushes back on the body, and this force known as ground reaction force, and the vector represented known as ground reaction force vector. Ground reaction force is a composite force, that is a resultant force that represents magnitude and direction of loading applied to one or both foot. Ground reaction force typically described having three components: vertical component forces and component directly horizontally. Now, what is optimal posture? Optimal posture, because the force of gravity constantly which is acting on the body, and ideal standing posture will be one in which the body segments were aligned vertically and the line of gravity passed through all joint axes. Now, normal body structures make such an ideal posture impossible to achieve, but it is possible to attain a posture that is close to the ideal. In an optimal standing posture, the line of gravity is close to but not through most joint axes. Therefore, the external gravitational moments are relatively small and can be balanced by internal movement generated by passive capsular and ligamentous tension, passive muscular tension, and a small but continuous amount of muscle activity. If a faulty posture are habitual assumed continually on a daily basis, the body will not be recognized and the posture as abnormal. And over time, structural adaptations such as ligamentous muscular injuries lengthening will occur. Now, analysis of standing posture. Analysis of standing posture is an observational analysis of posture in a sagittal plane which involves locating body segments in relation to line of gravity. A plumb line or a line with a weight of no one end drop from ceiling and passing through external auditory meatus of the ear may be used to represent line of gravity. Evaluator of posture should be able to determine whether a body segment or joint deviate widely from normal optimal posture alignment by using their observational skill. Now, to judge how well a posture maintains stability, we analyze body's alignment with regard to the gravity line of application, that is gravity line. Now, in the sagittal plane, gravity line is located anterior to the ankle joint lateral axis, which producing ankle dorsiflexion movement, necessity activity in the ankle plantar plexus. Anterior to the knee joint lateral axis, which producing a knee extensor movement, necessity no muscles activity tension in muscle knee ligament. Now, posterior to hip joint lateral axis, which producing a hip extensor movement, necessity no muscle tension in the anterior hip ligament, that is iliofibular ligaments. Now, when we must maintain the center of gravity aligned over the base of support center, certain joint movement indirectly affect other joint. For instance, in a closed chain, ankle dorsiflexion which causes knee flexion, ankle plantar flexion which produces knee extension, hip extension which produces knee extension, hip flexors which produces knee flexion. Now, in closed chain posture like standing, changes in one joint alignment often require changes at other joints. Here are several examples. While standing, turn your kneecap inward then outward. Notice how rotating lower extremity affects the subtalar joint alignment in a closed chain. That is tibial internal rotation, then flattening of arch, then subtalar progression. Tibial external rotation, that is raising of arch, and subtalar supination. Now notice how rotating tibia with respect to femur affect knee motion, including screw-home mechanism. Now in tibial internal rotation, reversible screw-home mechanism, that is knee flexion. Now in tibial external rotation, screw-home mechanism, that is knee extension. You can produce similar sets of complementary lower extremity movement by moving the pelvis in an relation. While standing with weight on both feet, twist so that the right side of pelvis moves forward. Now standing with a flat back or hunchback and a text neck. A flat back means your pelvis is tucked in and your lower back is straight instead of naturally covered, causing you to stoop forward. People with a flat back often find it difficult standing for a long period. This posture is often caused by muscle imbalance, which encourage you to adopt such a position. Now, spending long periods sitting down can also contribute to a flat back. Hunching over your keypad word is usually a sign that you have a tight chest and weak upper back. Over time, this type of posture can contribute to developing rounded upper back, which can cause shoulder and upper back stiffness. Now, when hunching over a computer, your head may tend to lean forward, which can lead to poor posture. Using a mobile can cause similar problem, the text neck. Now, rounded shoulder. A way to tell you if you have a rounded shoulder is to stand in front of mirror and let your arm hangs naturally by your side. If your knuckles face forward, it may indicate that you have a tight chest and a weak upper back, giving the appearance of rounded shoulder. Now, rounded shoulder typically caused by poor posture habits, poor imbalances, and focusing too much on certain exercise, such as too much focus on chest strength while neglecting upper back. Now, in kyphosis. Kyphosis is a common condition that is a forward rounding of your upper back region. It is compared to natural curve which have curved around 20-50 degree. Kyphosis excessive curve greater than 50 degree. Now, this causes your spine to hunch over and make your appearance to be slouching or have a hunchback. Kyphosis can be seen at any age, but it is most commonly seen in older women after osteoporosis, which weaken the bone in the spine until they crack and compress. If you suffer from kyphosis, you may experience back pain and stiffness also. Now in flat back, it is mentioned before spine has a natural curve. It has a two curve forming S-like shape. When you have flat back syndrome, spine loses the lower curve and become flat. This causes spine to become imbalanced and the patient tend to lean forward. If you have a flat back, you may be trouble standing up straight or having a constant back or leg pain. Now the flat back syndrome may develop due to degenerative disc disease, compressive fracture and paralysis spondylitis. Now, lordosis. Everyone has a natural curve in the spine called lordosis. But when your posture exaggerate the spinal curve, it can cause hyperlordosis or sway back. When this condition occurs, spine curve invert at the lower back and neck area. Usually cause back pain and discomfort as well as affecting your ability and suffer from lordosis or sway back. It may appear that you are sticking out your stomach and buttocks. Your shoulder to sit further back and your head tilt forward. This will throw off your balances and back to fall harder. Now, this posture condition caused by many different conditions, things, kyphosis, obesity, or pregnancies. Now, what we study in whole today, what is posture? Posture is the defined as the attitude which is assumed by the body either with support during a course of muscular activity. Now, what is common faulty postures? Common faulty postures, lordosis, flat foot, sway back, kyphosis. Okay. Now, what is kyphosis? Hunchback usually refers to abnormal curved spine. This is the reference. Thank you.